Okay, let's talk about one of the most misunderstood pains out there, sciatica. In this explainer, we're going to completely reframe how you think about that shooting leg pain and show you why getting the right diagnosis is really the only first step to relief.
You know the one I'm talking about. That sharp, zinging pain that shoots down your leg and immediately makes you think the worst. It's a pain that comes with a whole lot of fear, mostly because of what we think it means.
But here's a thought. What if that common understanding is, well, wrong? What if the actual path to getting better starts not with treating sciatica, but with asking a much, much better question?
So many people, maybe you're one of them, get an MRI report back, and it's filled with these terrifying sounding terms, right? Foraminal narrowing, annular fissure, and your brain just jumps straight to surgery. And that's totally understandable. But here's the thing. An MRI report on its own almost never tells the whole story. And this brings us to the absolute core of the misconception. A lot of us walk into a clinic and say, I have sciatica. We say it like it's the final answer, like it's the diagnosis. But from a clinical standpoint, it's not. And this is where we need to make a really crucial shift in our thinking. We have to stop seeing sciatica as the disease and start seeing it for what it is, a clue. It's not the final destination, it's just the start of the investigation.
So what is sciatica, really? It's just a pattern of pain. It's a description of where you feel it. It tells us nothing about why you're feeling it. And this is so important because you can't effectively treat a symptom, you have to treat the cause.
And check this out. This is a perfect example of why this distinction is a game changer. Someone whose leg pain gets worse when they sit or cough is telling a completely different story than someone whose pain flares up while walking, but feels better when they lean on a shopping cart. The first story points to a disc herniation. The second, spinal stenosis. It's the same symptom, that leg pain, but with two totally different causes, which means they need two totally different treatment plans.
So how does a good clinician figure out the real culprit? Well, it's not by just glancing at an MRI. It's detective work. It's a hands-on investigation. They listen, really listen, to your story. They do specific physical tests to see how your body responds. And only then, after all that, do they look at the imaging. And they always interpret it based on what they found during the actual exam.
And now for the best part, the really hopeful part. Once you get that correct diagnosis, the path forward is actually incredibly positive. This isn't about jumping to crazy measures. It's about the proven power of conservative care.
This is the number that should just give everyone a huge sense of relief. Nearly 90%. Just let that sink in for a second. The vast, vast majority of people who have this kind of pain get better without ever having to go under the knife.
And hey, this isn't just wishful thinking or some feel-good platitude. This is based on huge clinical trials that have shown over and over that for most people, the long-term results, how you feel, how you function, are just as good with non-surgical care as they are with surgery. The big takeaway is that most people can and absolutely should give conservative care a real chance to work. So what does this first-line treatment even look like? Well, think of it like a 1-2 punch. First, you've got hands-on manual therapy, things like specific spinal manipulation to get right at the source of the problem. And second, you have active exercise therapy, which is all about safely getting you moving again and building up strength.
And as orthopedic chiropractor Dr. Mark Croucher says, these aren't just alternative options. No, they are the standard, evidence-based place to start. And they're considered first line for a super simple reason. They work, and they can help you get better faster.
Okay, but what if your case is a little more complicated? This is where the old idea of just one doctor working all alone really starts to fall apart. Modern spine care, it's a team sport.
A great spine clinician doesn't operate in a silo. They're part of a network. They're working with and talking to neurosurgeons, pain specialists, and orthopedic physicians, all to make sure you get to the right expert at exactly the right time.
The beauty of this whole model is what we call a no wrong door system. It means that if your condition does need to be escalated to a surgeon, it happens fast, no delays, and just as important, if you don't need surgery, you're protected from going through procedures you never needed in the first place. And that brings us to something that is absolutely critical for you to know. Because while most cases get better with conservative care, there are a few red flags that mean you need to get checked out right away.
If you're experiencing weakness in your leg that's getting worse and worse, any new changes in your bowel or bladder control, or numbness in the groin area, that's not a wait-and-see situation. That requires urgent medical attention. So, after all this, how do you take all this information and actually take control of your own recovery? Well, it really starts with knowing what to look for and what questions you should be asking. Think of this as your personal checklist. You want to find someone who really is a specialist in spine conditions. You want someone who does a thorough, hands-on exam before talking about treatment. They should be able to clearly explain exactly how their treatment plan is matched to your specific cause. And finally, ask them who they work with. A great clinician is always a connected clinician. So, if you remember just one thing from all this, let it be this. For the majority of people, sciatica is not a surgical problem. It's a diagnostic problem. It's a problem of matching the right treatment to the right cause.
And that leaves us with one last question, a question for you to really think about. As you look at your own journey with this pain, ask yourself, is the treatment plan you're on, is it actually solving the right problem? Because finding the answer to that question is the first, and honestly, the most important step to finding relief.
I stopped trying to find a doctor who would listen, and I did this instead. For years, I was doing everything right. Eating clean, exercising, getting 8 hours of sleep, but I was still exhausted. I had constant brain fog, and my hormones felt completely out of whack. Every doctor told me my labs were normal, and it was probably just stress. I was about to give up until I found Holistic Health. It's a free AI wellness tool trained by functional medicine experts. I spent 5 minutes answering questions about everything: my symptoms, my sleep, my digestion, and it built me this. And this was the light bulb moment. It didn't just give me a list of problems, it connected the dots. It showed me how my gut health was likely impacting my hormones and how that was causing the fatigue and the brain fog. It even gave me a clear list of potential root causes, supplements to research, and even the specific lab tests to ask for. Its tip is secure. Over 77,000 people have used it, and it's 100% free to get your blueprint. If you feel like you're not being heard, start here. Understand your body first and then decide your next step.